Good evening to everyone and welcome to today's wonderful evening with Dr. Murali Bharadwaj. If you look at the NEETPG 2025 question paper, 2024 question paper, a majority of the questions, they're all clinical vignette based. Almost 90% of questions are clinical vignette based, image based. So you should be very much equipped with all these various clinical scenarios in day-to-day practice. So there are 10,000 clinical case vignette based, image based clinical scenarios I have accumulated, and I make them available as a PDF for all of you to do the revision, from which this 200 marks paper is going to come, all the 5 sets of 40 questions in the NEET-PG exam. So let's make the great beginning, Doctor. Can the online students punch the voice loud and clear for all of you? A 35-year-old male with the shortness of the breath, hypoxemia, and there is a high alveolar arterial oxygen gradient. So in this clinical scenario, what is the likely underlying cause? So you should remember what you are seeing here is a wedge-shaped embolus. So it is a classical clinical vignette on pulmonary embolism where the CT, contrast enhanced CT, is the investigation of choice, is what you need to remember. Now, doctor, a 70-year-old male with a history of hypertension, very important clue, hypertension, severe abdominal pain, and the CT scan, what is it showing? It is showing abdominal aortic aneurysm. A lot of times, abdominal aortic aneurysm is an incidental finding. For some other reason, an elderly person with a history of atherosclerosis, if you happen to do the ultrasound, then you will find as a surprise that there is a abdominal aortic aneurysm. So what is the next step in the management? So depending upon the size, because you have got a severe abdominal pain, you need to do an immediate surgical consultation for the possibility of repair, is what you have to basically remember. Now, doctor, a 65-year-old male presents with severe back pain. He also has hypotension. And what you're able to see here, you're able to see a ruptured abdominal aortic aneurysm on ultrasound. So this is a surgical emergency, and the treatment of choice would be to do an emergency surgery for a ruptured abdominal aortic aneurysm, is what you have to remember. So now, doctor, a 45-year-old woman notices a mole in her back. It has changed in the color and size. So always you should know what are the A, B, C, D, E criteria before you consider a benign mole, whether it turned into malignant. So asymmetry, border irregularity, the type of color, where it got more variegated in its color, and 6 mm. What is the buzzword? 6 mm diameter, and the evolution of it, how it is evolving over a period of time. A, B, C, D, E, about the malignant melanoma, is what you have to remember. So now, doctor, a 28-year-old male is being brought to the ER after a high-speed car accident. Now, using the A, B, C, D, E approach, what is your first priority, doctor? Always the airway. So, airway, head tilt, chin lift. Head tilt, chin lift is what you need to remember. Then breathing. Look, listen, and feel. Circulation, heart rate, capillary refill time, then disability, that is how alert, how responsive to the voice. Ramu, get up, Ramu, get up. When you said how Ramu is responding, and pain responsiveness is there or not, or is he unresponsive? And finally, exposure. For example, organophosphor poisoning is there. You have to remove the clothes, otherwise there is a continuous absorption which is happening. That's the reason E is the exposure is what you should remember. Now, a 50-year-old presents with sudden onset of severe abdominal pain. And what do you see in this abdominal X-ray, doctor? What do you see here? There is air under the diaphragm. Once more, here also, there is a air under the diaphragm. The presence of the air under the diaphragm, a very important feature is air under the diaphragm is an indication of a possibility of perforated peptic ulcer, the classical clinical vignette which you should not forget. Now, a 32-year-old male involved in a motor vehicle accident presents with the right upper quadrant pain. A CT scan is showing the laceration of the liver. So what is the best initial management? Always you need to look for the hemodynamic stability, and then you need to do a non-operative management if the patient is hemodynamically stable. So before the advent of a good CT, a lot of cases of splenic laceration and liver laceration, they used to operate. A lot of unnecessary operations happen. But after the advent of the CT, we are now able to grade the degree of severity. So if the hemodynamic stability is there, if it is not a very severe degree of laceration, then we can be able to manage the patient conservatively, is what you need to remember. So now, doctor, a 25-year-old male presents with a stab wound in the abdomen. Stab wound in the abdomen. What is the next best step in the management? Always, whenever there is any penetrating abdominal trauma, as what you can see, penetrating abdominal trauma, it is an indication for blunt trauma, penetrating trauma. Two types of the trauma which you need to remember. So whenever there is any penetrating trauma, then exploratory laparotomy is considered to be the treatment of choice. Now a 65-year-old male who is having smoking history and undergone screening for abdominal aortic aneurysm. So if you want to screen abdominal aortic aneurysm, what is the screening modality of choice, doctor? So you should remember, it is the abdominal ultrasound, which is the best screening modality for the abdominal aortic aneurysm, is what you need to remember. Now a 40-year-old diabetic patient presents with confusion, a fruity odor of the breath, and the ABG is showing metabolic acidosis. So how do you make a diagnosis of diabetic ketoacidosis? It typically leads to high anion gap metabolic acidosis, pH less than 7.3. So obviously, to overcome the acidosis, what will patient will do? He will try to hyperventilate. When you hyperventilate, you get rid of the carbon dioxide out of your body. So there is a decrease in the total carbon dioxide levels, is what you need to remember. And the bicarb will be typically decreased because it's a compensatory mechanism to compensate for the acidosis. And the potassium levels will increase. Why? Typically, diabetic ketoacidosis, what kind of condition is it? Diabetic ketoacidosis is a condition of insulin subsolute deficiency. What is the purpose of insulin? Insulin, typically, can the online students can punch his voice loud and clear? Insulin typically moves. You should remember. What is the function of insulin? So you should remember, insulin जो होता है, insulin typically you have the cell K plus potassium and glucose, both of them are pushed intracellular. So that is the reason, if there is no insulin, glucose remains outside the cell, hyperglycemia. Potassium also typically remains outside the cell. But at the same time, what else will happen? Diabetic ketoacidosis is a state of dehydration. Once there is a dehydration, there is a decreased renal plasma flow. And the decreased renal plasma flow will cause the stimulation of an increase in the renin. And whenever the renin increases, it leads to increased angiotensin. Angiotensin will cause an increase in aldosterone. And what is the effect of aldosterone? What is the effect of aldosterone? So, doctor, you should remember, aldosterone, typically you have the glomerulus, Bowman's capsule, and the ascending and descending limb of loop of Henle and collecting duct. At this level, high aldosterone will lead to retention of the sodium back into the body, and loss of potassium into the urine. And because of the loss of potassium, typically, if you look at a patient of diabetic ketoacidosis, because of the decreased renal plasma flow, increased renin, increased angiotensin, increased aldosterone, and loss of potassium in the urine, the absolute amount of the potassium levels are low in a patient of DKA. But because even though the total body potassium levels are low, still all that is remaining extracellularly. Because potassium is required to move insulin is required to move the potassium intracellularly, which is not happening. So when it does not happen, if the insulin is not available in diabetic ketoacidosis to move, even that little potassium, total body potassium is low. That low potassium intracellularly, what will happen, doctor? Potassium remains outside the cell. Typically, when you take out a plasma sample for potassium, it may show normal when a patient of DKA presents, but actually his total body potassium levels are low. The moment you start insulin therapy, then even that low total body potassium will be moved into the cell, and the patient will go into hypokalemia. So please don't forget this funda, doctor. DKA patient, whenever he presents, initially his potassium levels may show normal, because though the total body potassium is low, because of the potassium loss into the urine, because of the high aldosterone levels, because of the dehydration and secondary hyperaldosteronism, still all that low potassium is outside the cell in the plasma because of the lack of insulin. That is the reason the patient's potassium levels will be typically normal at the time he comes into the ICU. But the moment you start the insulin therapy for DKA, then all that potassium will run inside the cell. Then the low total body potassium will lead to hypokalemia, is what you have to remember, doctor. So this very, very important funda, you should never forget in your lifetime. So coming back to our journey, we have initially potassium levels will be high or normal, but once you start insulin therapy, they become low, is what you should remember. So now, doctor, the next question. A 45-year-old female, difficulty in swallowing both the solids and also liquids Suppose if somebody has a difficulty to swallow only the liquids, but not only the solids, but not liquids, that means it's an obstructive lesion. If a patient has a problem to swallow both the liquids and solids equally bad, then it is a problem with the peristaltic movement or a neuromuscular incoordination. So typically in achalasia, there's a difficulty to swallow both the solids and liquids. And what is this called as bird beak appearance, which is typical of achalasia, is what you need to remember. So this is how, doctor, little you need to bite every day. There are 10,000 clinical vignettes, image-based, which you need to master before you go to the NEETPG exam. So a 30-year-old presents with a painful swelling in the vaginal area. On examination, there is a tender fluctuant mass noted. So typically, what is a tender fluctuant mass near labia? It is the Bartholin's duct abscess, which need to be treated by giving incision and drainage is considered to be the management of choice, is what you need to remember. A 50-year-old man with chronic sinusitis presents with headache and fever. CT scan is showing ring enhancing lesion, which is very classical of the brain abscess, is what you need to remember and how to recognize. Why brain abscess is a ring enhancing lesion? If you pass contrast, typically an abscess is highly vascular. There's an increased vascular supply to its covering, the layer covering the abscess. That's the reason when you pass contrast, it will be a ring enhancing lesion. The brain abscess is what you need to understand. A 25-year-old male presents with a sore throat, fever, difficulty in opening the mouth. And on examination, there is a unilateral swollen tonsil with the uvular deviation. So what is the next step? So any peritonsillar abscess can deviate the uvula. And the best thing is to do needle aspiration of the peritonsillar abscess, is what you need to remember. A 4-year-old boy presents with fever, neck stiffness, and difficulty swallowing. A lateral neck X-ray is showing the widening of the prevertebral space, which is very classical of retropharyngeal abscess, is what you need to remember. Retropharyngeal abscess. 28-year-old sexually active female presents with a lower abdominal pain, fever, vaginal discharge, and pelvic examination is showing adnexal mass. So this is a classical appearance of tubo-ovarian abscess as a complication of the pelvic inflammatory disease, is what you have to remember. A 7-year-old child presents with the frequent episodes of the staring and unresponsiveness. And when you have done the EEG, what you are seeing, doctor? 3 hertz spike and wave pattern is what you are seeing. So which is very classical of absent seizures, is what you need to recognize. One of the favorite image-based question of 3 hertz spike and wave pattern, which is asked in the NEETPG, USMLE, FMGE, INICET, any damn exam in the world that you take. A 65-year-old patient is receiving chemotherapy. He has fever, neutropenia. How do you calculate the absolute neutrophil count, doctor? Percentage of the segments plus percentage of the bands into WBC divided by 100 will give you absolute neutrophil count, is what you need to remember. So what is the normal range, doctor? Neutrophils typically constitute 60%. 1 to 4% will be eosinophils. Basophils will not be much, hardly 0.5 to 1%. And lymphocytes will be 20 to 30%, and monocytes are 26%, is what you need to remember. So whenever absolute neutrophil count is between 1500 to 2000, typically there is no significant risk. But if it is less than 500, there's a very severe risk, absolute neutrophil count. Less than 500 means there is a very severe risk of developing infections, and you need to prophylactically treat those infections and increase the neutrophil count. So how do you increase the neutrophil count, doctor? Sargomastim, filgrastim. So GCSF, GMCSF, granulocyte colony stimulating factor, granulocyte monocyte colony stimulating factor, is considered to be the management. 8-year-old is being brought to the ER by her daughter, who is concerned about the multiple bruises is what you are seeing here. What is the most important thing that you need to remember? Always in an elderly, when multiple bruises are there, you need to consider the possibility of any elder abuse, and you need to report it to the Adult Protective Services immediately as a doctor. 35-year-old has recurrent kidney stones and fatigue, and there is a hyperchloremic metabolic acidosis with a normal anion gap. Urinary pH is 6.5. What is the likely diagnosis? It is classical of renal tubular acidosis is what you should remember. Once more, proximal RTA, you need to know proximal RTA, distal RTA, type 4 RTA, the 3 types of renal tubular acidosis. How to differentiate them? Where is the acidification present and absent? Where is rickets present? Typically, rickets is a problem, which is the problem in proximal RTA. And nephrocalcinosis is a feature only of distal RTA, but not proximal RTA. Urinary anion gap is typically positive in all the 3. Urinary anion gap. And urinary pH is typically less than 5.3 if it is a proximal RTA. It is more than 5.3 if it is a distal RTA. So once more, in our regular video library on the SCORE Learning app, we have discussed all this funda, doctor. All right. So let me introduce to you playscore.live. So if you go to playscore.live, all our classes are broadcasted from here only every day. So we have a feature called video library. So 5,000 short videos, 400 hours of video library. It covers all the 20 subjects, 1-year subscription for a very affordable price of just 6,000 rupees. Similarly, 50 NEETPG full-scale mock tests in the form of PDFs, and another 25 NEETPG full-scale mock tests in form of PDFs with a weekly Sunday discussion, and 50 subject-wise mock tests, PDFs and live discussion on every Friday and Saturday. So this is the mock test series offered for 6,000, very affordable. And there is a notes where 70,000 high-yield facts are being provided as single liners, short sentenced single liners called tweets. So 20 subjects got tweet books, PDFs covering 70,000 high-yield facts, and 10,000 PYQs of the NEETPG of the last 10 years, arranged as single liner tweets in the form of PDFs, and 6,000 FMGE PYQs last 10 years as PDF, and 6,000 INICET PYQs of last 10 years as PDF, and 5,000 clinical case vignettes as a PDF, and 3,000 images based clinical vignettes as PDF. All this downloadable, shareable PDF to you. So provided as a notes for just 6,000. So today only take opportunity to call our helpline. So on the playscore.live, you have our helpline numbers. You can give a call and then subscribe. And every day, just like now we are discussing the class, we have it broadcasted onto the playscore.live. So you can join and share with your friends. And our daily live online class YouTube schedule is also made available on the website. So enjoy preparation. What you need is right study material, a classmate who is serious to prepare, just like Dr. Murali Bharadwaj with you, every day, and solve enough number of PYQs first, know what examiner asks, know what common clinical vignettes, common image-based questions are being asked. But 6 months spend with us and we will make you to become the topper. Very nice to see Akhilesh Singh. So Akhilesh, is my voice loud and clear for all of you? So doctor, that is the story of renal tubular acidosis. Now a 25-year-old female comes to the ER after taking a large quantity of acetaminophen. What is acetaminophen? Paracetamol, as a suicide attempt. So what is the tool that will control your treatment? So you should know there's a Rumac Matthews nomogram, which will let you know paracetamol, time since overdose. There is a nomogram based upon the concentration levels of the acetaminophen. So there are lithium, acetaminophen, acetyl salicylic acid. So all these drugs, tricyclic antidepressant overdose, benzodiazepine overdose, barbiturate overdose, how do you treat is a favorite topic for the examiner. A 55-year-old who has got a sudden swelling of the lips. He has a difficulty in breathing. So what is the most likely cause? So you should remember always, ACE inhibitors are notorious to lead to the development of angioedema is what you should remember. A 30-year-old woman with a history of pelvic inflammatory disease presents with a severe abdominal pain, lower abdominal pain, vaginal bleeding. There's an adnexal mass. So what is your diagnosis, doctor? It is a ectopic pregnancy. Always ectopic pregnancy is a surgical emergency. No more waiting and watching. You need to jump and treat the ectopic abdominal pregnancy. Ectopic pregnancy is what you need to remember. A 6-year-old male is having atrial fibrillation, presents with a sudden onset of the severe pain in the right leg. So what is the possibility? So once you have atrial fibrillation, there's a great chance of the embolism to happen. So when that embolus happen to travel into systemic circulation, it can lead to arterial occlusion, leading to acute limb ischemia. That's the reason always be careful in the patients who are having the atrial fibrillation presenting with acute limb ischemia is what you should remember. A 45-year-old obese woman presents with a velvety, hyperpigmented clots on the back of her neck. So what is your diagnosis, doctor? So these are typically acanthosis nigricans, which is a sign of insulin resistance is what, and type 2 diabetes is what you need to remember. A 30-year-old male plans to climb the Mount Everest. What prescription you want to give to prevent altitude sickness? So you should know, typically higher altitude may we hyperventilate, leading to respiratory alkalosis, increased intracranial pressure. So if you happen to give acetazolamide, it is a carbonic anhydrase inhibitor, and that will increase the soda bicarb excretion. So respiratory alkalosis, if it is there also, all that bicarbonate is lost into the urine, and there is a decreased CSF formation. So that is the reason we have to give acetazolamide, Diamox is the treatment. A 50-year-old male with a history of alcohol presents with severe epigastric pain. Serum lipase is elevated. Ultrasound is showing, what is the feature ultrasound is showing, doctor? Gallstones. So what is your likely diagnosis? The gallstones can lead to the obstruction of the pancreatic duct and can lead to the development of acute pancreatitis. Gallstone induced acute pancreatitis because of the pancreatic duct obstruction is what you have to remember. A 35-year-old male with a history of asthma presents with a worsening cough, and there is a wheezing. CT scan, what is it showing? Central bronchiectasis. So what is your diagnosis, doctor? ABPA, allergic bronchopulmonary aspergillosis, central bronchiectasis. That's a very important clue for you to understand. The ABPA is what you need to remember. A 22-year-old female presents to the ER after taking aspirin. There is a anion gap metabolic acidosis. What is the best important next step, doctor? So acetyl salicylate, we alkalinize the urine to get rid of. At the same time, we need to give activated charcoal. So you should know, whenever you take aspirin, it leads to lactate formation, and that can lead to metabolic acidosis. Same time, it stimulates respiratory center with hyperventilation leading to respiratory alkalosis. So both the things are possible with aspirin overdose is what you need to remember. A 55-year-old postmenopausal woman with abnormal uterine bleeding, transvaginal ultrasound is showing increased endometrial thickness. Always a postmenopausal woman presenting with an increased endometrial thickness, you should always evaluate for the possibility of an endometrial carcinoma. So how endometrial thickness is calculated, how much thickness is considered to be an indication for doing the biopsy, all this funda you need to know for the tomorrow's NEETPG exam. A 28-year-old pregnant woman at 8 weeks of gestation presents with vaginal bleeding and cramping. Ultrasound is showing empty gestational sac. So what is your diagnosis, doctor? Typically, it is a spontaneous abortion with an empty gestational sac, blighted ovum is what you need to understand. A 24-year-old presents for a request of elective abortion at 10 weeks of gestation. What is the most common surgical procedure you do to induce abortion at this age, doctor? You should know the equipment, ayudhams which are required to treat, that is dilatation and curetta is considered to be the management of choice. A 40-year-old patient with a history of asthma, which is worsening with worsening shortness of breath. And what do you see here? Ring shadows, which are indicative of bronchiectasis, are seen centrally, which is a feature of ABPA, allergic bronchopulmonary aspergillosis. A 55-year-old male with a history of sinusitis presents with headache and fever, and the MRI is showing ring enhancing lesion, which is very typical of the brain abscess. One of the sources is from the nose, right? Sinusitis. So surgical drainage and antibiotic coverage is considered to be the management of choice. A 60-year-old male presents with hypotension, altered mental status, and the ABG is showing metabolic acidosis with the elevated anion gap. So in sepsis, what is the cause of the high anion gap metabolic acidosis, doctor? Sepsis lead to lactic acidosis. Lactic acidosis lead to high anion gap metabolic acidosis is what you need to remember. A 70-year-old with a history of smoking, with the cough pain, with the ankle brachial index. That means you check the BP in the ankle and also the upper limb. And how do you calculate ABI to know the peripheral vascular disease? Ankle systolic pressure divided by brachial systolic pressure is what you need to remember. For example, let us say you have 126 and 134, then the ABI will become 1.06 as a ratio is what you need to remember. A 4-year-old child presents with a spiral fracture of the humerus, and the parents provide a inconsistent history, which is very typical of child abuse is what you need to remember. A 65-year-old who has a CKD lab report is showing hyperkalemia. So always you should know what are the typical electrolyte disturbances that we see in a patient of chronic kidney disease and renal failure, doctor, chronic renal failure. Hypocalcemia, because in chronic kidney disease there is no vitamin D production, 125 dihydroxy vitamin D. That's the reason there is a development of hypocalcemia. There is a hyperphosphatemia because phosphate excretion requires kidney to function. There is a hyperkalemia, hyperuricemia, hypermagnesemia. The combination is the electrolyte disturbances in chronic kidney disease is what you have to remember. A 17-year-old presents with a widespread, painful nodules and cysts on his face, not responding to the over-the-counter preparations. So what is the next management of acne, doctor? It is the oral isotretinoin systemically is considered to be the management. A 55-year-old reports hearing loss, tinnitus, and MRI is showing a cerebellopontine angle mass. So what is your diagnosis, doctor? It is acoustic neuroma. Bilateral acoustic neuromas, if they are there, you should think about the possibility of neurofibromatosis type 2 is what you should remember. So now, doctor, a 39-year-old HIV patient presents with purple clots on the extremities. So what is your diagnosis? These are the classical Kaposi sarcoma lesions, right? Kaposi sarcoma lesions, which you have to recognize in the tomorrow's exam. A 65-year-old presents with a dark lesion on the heel with irregular borders, dark lesion on the heel with irregular borders as what you can see. So it is an acral lentiginous melanoma, which you need to recognize in the image-based questions in the tomorrow's exam. A 50-year-old with an increased foot and hand size. So classical phenotypic features of the acromegaly, right from our 9th class biology days, we are knowing this question. So a 60-year-old smoker presents with muscle weakness, hyperpigmentation, and the chest imaging is showing a lung mass. What you are able to see, doc? Lung mass. What is the most likely condition leading to the development of the muscle weakness and hyperpigmentation? It is producing ectopic ACTH, right? Ravinder Singh is saying, addicted to your videos. Oh my God. I'm also addicted to the students. NEETPG के पहले दिन और बाद का दिन भी हम गाते रहेंगे, right? So generation of the generation, new students come, but the teacher remains the same, right? So doctor, always remember, there's a muscle weakness, hyperpigmentation. So whenever ectopic ACTH is produced, ACTH is produced from a precursor called POMC, pro-opiomelanocortin, from the same peptide, melanocyte stimulating hormone and ACTH are produced. Every time ACTH is produced, MSH is released, and that leads to hyperpigmentation. And all these endocrine manifestations, small cell carcinoma is notorious. Two carcinomas in lung are central. क्या होता है? Squamous cell carcinoma and small cell carcinoma, SSC, secondary school certificate. Squamous cell, small cell, central, whereas adenocarcinoma is peripheral, is what you need to remember. So now, doctor, a 80-year-old with extensive sun exposure presents with rough, scaly lesions on the scalp. So it is a classical actinitic keratosis which you need to remember. A 63-year-old presents with chest pain, diaphoresis. And what do you see here? ST segment elevation, ST segment elevation, ST segment elevation in V4. So where else? It is there in the V1, V2, V3, V4. So that is called anteroseptal infarction is what you need to remember. A 28-year-old presents with fever, dyspnea, cough after starting a new antibiotic. That new antibiotic has led to the development of eosinophilic pneumonia. So whenever there is any fever, dyspnea, cough after starting antibiotic and you have been given a high resolution CT, you should recognize the eosinophilic pneumonia is what you need to remember, which is drug induced quite often. A 4-year-old presents with frequent bruises and there are numerous blast cells. So you should know how to identify in the peripheral smear. ALL, AML, CLL, CML, everything you should know. Right, doctor? Now, 50-year-old with anemia, thrombocytopenia, frequent infections, bone marrow is showing. What are these cells, doctor? They're having the OR rods, right? So the presence of the OR rods make them myeloblasts, and it is a case of acute myeloblastic leukemia. How to recognize? The histology is a favorite image-based question of the examiner. Now, doctor, a 3-year-old presents with fever and otoscopy showing red bulging tympanic membrane, acute otitis media. So you need to treat with amoxicillin, which gives a wonderful coverage of the gram-positive cocci, which are commonly responsible. So now, doctor, a 30-year-old with sudden onset of vertigo, nausea, unsteadiness, without any hearing loss, So, mere pyare yaro, you should know one very important thing. So, vestibulocochlear. Vestibulocochlear. बच्चों, वेस्टिब्युलो होता है बैलेंस, वेस्टिब्युलो होता है बैलेंस, वेस्टिब्युलो होता है सेमी सर्कुलर कैनाल्स, वेस्टिब्युलो होता है लैब्रिंथ. Here's what you need to remember. Whereas कॉक्लिया जो होता है वो हियरिंग, सुनाई देने का apparatus है. So this is associated with hearing. So whenever any viral infection is there, it is not affecting the cochlea, but affecting only vestibular. Then you will have the nausea, giddiness, etc., which is called acute vestibulitis. Without cochlear involvement is what you need to remember. So acute peripheral vestibulopathy. Once more, doctor. One of the favorite questions you should know. So I leave all these image-based in the PDF format for you to download and share with your friends. So peripheral versus central. You should know this, every exam they ask. Peripheral may isolated vertigo, always present. Hearing loss is common in peripheral but uncommon in central vertigo. Disequilibrium is more severe in central vertigo. Autonomic symptoms are more in peripheral vertigo. Neurological features are present more in central vertigo, and compensation is very rapid in peripheral vertigo, and bedside head impulse test typically is abnormal in peripheral. So that is what you have to emphatically remember for the tomorrow's exam, doctor. A 40-year-old presents with petechiae, prolonged bleeding. There are promyelocytes. Tell me, doctor, of all the acute myeloid leukemias, which has the best prognosis, APML. Why? Because APML, you can use ATRA, all-trans retinoic acid to treat it. Where treatment is there, prognosis is good. But APML is a dirty thing because it leads to DIC, disseminated intravascular coagulation. So if you have a patient of APML admitted under you, be ready to have a good blood bank, which provide you the fresh frozen plasma, platelets, etc., to support the patient who is having APML. Otherwise, it will be a bloodbath. Now, a 22-year-old is admitted after a severe workout with muscle pain, creatine kinase levels are high, and he is having renal failure. So typically, what is your diagnosis? It is rhabdomyolysis. Elevated CPK is a very important clue in the clinical vignette, which you need to basically remember. A 55-year-old is intubated after a severe pneumonia, shows worsening oxygenation. So pneumonia infection can lead to acute respiratory distress syndrome. So any worsening of the oxygen levels, SaO2, type 1 respiratory failure, ARDSs, that is hypoxia with a normocapnia, is the feature of non-cardiogenic pulmonary edema, which is the definition of ARDS, is what you have to remember. A 37-year-old with chronic obstructive pulmonary disease presents with an increasing shortness of breath and wheezing. So how do you want to manage? So you need to give bronchodilators and supplemental oxygen. So how will you recognize COPD? COPD typically has, if it is emphysema, very narrow tubular heart shadow because of the hyperinflation of the lungs is what you have to remember. Now, a 72-year-old post-operative patient presents with low urine output and elevated serum creatinine. So post-operatively, there can be, operation can lead to significant blood loss and can lead to hypotension, which can lead to the development of the acute tubular necrosis is the possible diagnosis. In a post-operative present patient, in the setting of a post-operative patient, a 34-year-old man with acute onset of severe vertigo and nausea, no hearing loss. No hearing loss means it is acute post-viral vestibular neuronitis. So it can be treated by giving corticosteroids is what you should remember. A 6-month-old presents with the failure to thrive, loud heart murmur. And what can you see? This is the right ventricle, this is the left ventricle. Between the right and left ventricle, rangoli ho raha hai. The good blood is mixing with the bad blood across the VSD. That's how you need to recognize the 2D echo. The VSD is what you should remember. So now, doctor, a 29-year-old presents with painful orogenital ulcers. What is the first line of treatment of herpes simplex virus? Acyclovir. Acyclovir is the first line of the treatment. So all these image-based questions you have to master, doctor. 70-year-old who is having memory loss and disorientation. MRI showing cortical atrophy, You can see the sulci and gyri are showing deep insinuation There's a lot of empty space surrounding, which is characteristically the feature of Alzheimer's disease, is what you need to remember. Now, a 45-year-old has anemia, thrombocytopenia with renal impairment. Anemia, thrombocytopenia, renal impairment. All the three should strike into your mind hemolytic uremic syndrome. So, typically in hemolytic uremic syndrome, what will happen, doctor? Typically in uremic syndrome, what will happen? You are having the platelet with GP1B, and the von Willebrand factor is having multimers. Adam TS13 will lead to the breakage of these multimers. If it is not there, deficiency of Adam TS13 is there, then more and more number of platelet aggregates will form. They block the blood vessels by forming platelet-rich thrombi. They don't have clotting factors inside them. Only platelets are very rich in them. And that leads to ischemic injury to kidney, leading to uremia. And when the RBCs are negotiating through these capillaries, blocked by this platelet-rich clots, they get broken. That's the reason there is anemia, thrombocytopenia, renal impairment in hemolytic uremic syndrome, and you need to remember Adam TS13, which is the one which normally lead to the breakdown of the von Willebrand factor multimers, which is not happening, leading to the development of the platelet aggregation rich clots, is what you need to understand. Because why thrombocytopenia? Because all the platelets are being sequestered within those platelet rich clots in hemolytic uremic syndrome, is what you should understand. A 30-year-old with a known Addison's presents with nausea, vomiting, hypotension. So what is the immediate treatment? Always, whenever there is any hyperpigmentation with hypotension, you should think of the possibility of adrenal insufficiency. And hydrocortisone is considered to be the treatment of choice. A 55-year-old non-smoker presents with cough, which is persistent, and weight loss. There's a mass in the lung. So, typically, adenocarcinoma, it is peripheral. It can lead to the obstruction of the bronchus, can lead to post-obstructive pneumonia and atelectasis. That is what you need to remember. Another important clue, it is a non-smoker. So non-smoker is the cohort of people in whom adenocarcinoma is more common, unlike squamous cell carcinoma, more common in the smokers, is what you have to remember. So doctor, this brings us to the end of the today's evening. रोज मिलेंगे, रोज पढ़ेंगे, एक दिन कामयाब होके दुनिया को बताएंगे भाई मेरा नंबर आ गया. So please don't forget to visit playscore.live and also share it with all your friends. Please like this video, share this video, comment this video to make it viral. And every day I come online, every day we discuss at least 100 clinical vignettes, image-based questions, enrich our preparation, prepare for what examiner wants. That is most important thing for you to become the winner. Good luck, and we will meet once more tomorrow. Thank you.